Hello, my name is Angie Jolliff. This is my head-to-toe physical assessment video. My husband Jared has agreed to be my patient. Before we begin, he emptied his bladder and I had him change into some loose clothing for this exam. I measured his height, his weight, his full set of vital signs, which were all within normal limits. I tested his near vision using the Rosenbaum chart, his far vision using the Snellen chart, and this assessed cranial nerve number 2, which is the optic nerve, and they were all intact. I've washed my hands and I'm ready to begin the exam. Jared is alert and oriented ×4 and is able to carry on a conversation. He is able to articulate his words. This is all requiring cranial nerves number 5, 7, 10, and 12 to be intact. We will now begin with inspection of the head and face. So first, with inspection of the head and face, I am assessing that his head is midline, it is symmetrical. He's got normal hair distribution, there are no obvious lesions or open areas. His head is normal cephalic, his eyes are symmetrical, and they are in alignment with the top of his ears. Next, I'm going to palpate his head, checking for any masses or areas of tenderness, palpating his hair, noting the texture or any areas of alopecia. His hair does not fall out when it is stroked. Next is I'm going to palpate his facial bones, noting if there's any tenderness. I'm going to palpate the frontal sinuses, the maxillary sinuses, checking for any pressure or tenderness. Now to assess the temporomandibular joint, I need you to open, close. We're checking for popping, clicking, which there is none. Next is the test for light sensation. I'm going to have you close your eyes. This is checking cranial nerve number 5. And let me know where you feel the cotton tip.
Forehead, left cheek, right cheek, chin,
Good. And
arm.
okay. All right. So next, I'm going to ask you. We're going to test cranial nerve number 7. I'm going to ask you to do a series of things with your face. I need you to clench your teeth, wrinkle your forehead, puff your cheeks. All right, squeeze your eyes tightly shut, smile, and stick out your tongue. Good. Cranial nerves number 7 are all intact. Next, moving to the eyes, I'm going to inspect position, placement, looking at hair distribution of the eyebrows as well as the eyelashes. The eyebrows are full, the eyelashes are also full, and the eyebrows extend beyond the eye. Next, I'm noting the color of the sclera, which it is nice and white. I'm going to look at the conjunctiva, and it is nice and pink. Good. There is no eye drainage, and there is no edema. I'm going to palpate the lacrimal sinus, or the lacrimal apparatus. There is no enlargement with that. It is nice and smooth as well. Next, I'm going to test cranial nerves number 3, 4, and 6, which is the ocular motor nerves. I need you to stare at a spot on the wall. Cover your left eye. I'm watching for any extraocular movements, any nystagmus, okay? Cover your right eye. Same thing, watching for any extraocular movements or nystagmus, which is fine. All right, next is the test for the 6 cardinal fields of gaze. I'm going to have you follow the tip of my pen light here, and this is assessing that his eyes are moving smoothly. There's no nystagmus. Good. And the next test, I'm going to shine my pen light in your eye. This is checking that your pupils are equal and reactive and round to light accommodation. We're going to test both eyes here. Good. Now for the direct and consensual test, I'm going to shine the light in this eye and watch for the pupil response. Good. I'm shining the light in the left eye again and watching that the right eye is constricting, and it does. Same thing here, direct and consensual. Good. Next is the confrontation test. This is to check your peripheral vision. I'm going to have you cover your left eye, I'm going to cover my right eye, and I need you to let me know when you see my fingers in your field of gaze. Good. Same thing on the other side.
Okay.
Good. We're going to inspect your ears, looking at the alignment of your ears, noting any lesions, any masses. I'm going to palpate the auricles. They're nice and smooth, no masses. With this next test, I'm going to assess cranial nerve number 8, which is the acoustic nerve. And I'm going to walk behind you for this one. And this is the whisper test. I need you to cover your right ear. And I'm going to say some words and I need you to tell me what I say. ABC.
ABC.
Alright, cover your left ear.
1, 2, 3.
Good. Alright, the next test is the Weber test. I'm going to use the tuning fork, strike the tuning fork, place it on the top of your head, and I need you to tell me if you hear the sounds in one ear or the other better, and or if they're equal bilaterally.
Equal.
Good. Alright, next I'm going to strike the fork again. This is the Renee test. I'm going to place it on the mastoid bone, and I'm checking that air conduction exceeds bone conduction. I need you to let me know when you can no longer hear it.
Okay.
Alright,
Okay.
good. Alright, so I would test both sides. Next is the examination of the nose. First I'm going to inspect the nose using my pen light. I'm looking for position, it's midline. I'm looking at the internal structures of the nose, the nasal turbinates. They should be moist. The mucosa is pink. There's even hair distribution, and the nasal septum is midline with no deviation. Now we're going to check for patency of your nostrils. Good. Other side. Good. Next we're moving to the examination of the mouth and pharynx. First I'm going to inspect his lips, making sure that they're pink, they're moist, they're without fissures or cracks. Also looking at the corners, making sure there are no fissures. I'm going to ask you to open your mouth. I'm going to look at your gums. They're pink, moist, no bleeding. I'm looking at your teeth. They're nice and white. There's no broken teeth, no cavities. You have the right amount of teeth. There's no mouth odor. And also I'm inspecting the tongue for any lesions. And if you can lift up your tongue for me. I'm looking underneath of the tongue. This is the most common site for oral cancer. There's no lesions there as well. And I'm looking at the buccal mucosa. It is nice and pink. The hard and soft palate are within normal limits. The anterior and posterior pillars are also within normal limits. The tonsils are within normal size. The posterior pharynx is normal. And the uvula is normal size as well. Next I'm going to check your gag reflex. I need you to open up and say ah.
Ah.
Good. Alright, his uvula rises and falls, and he has a good gag reflex. Next is inspection of the neck. I'm looking at symmetry. I'm looking at the trachea, that it's midline, that everything looks smooth. I'm also looking at the thyroid, assessing for any thyroid enlargement, looking to see if there's any goiter, which I don't see. Looking for any abnormal pulsations, also looking for the jugular veins, checking for any distension there. Next I'm going to assess cranial nerve number 11, which is the spinal accessory nerve. I need you to, or actually first, active range of motion, I need you to shrug your shoulders. Good. Place your head to your ear. Other side. Alright, and up and back. Good. Alright, now I'm going to apply resistance and check. Alright, and back. Alright, side to side. Good. Shrug your shoulders. Good. Now I'm going to palpate his carotid pulses. I'm going to do one side at a time. They are 2+. The contour is smooth. There's a rapid upstroke and a slower downstroke. Now I'm assessing tracheal position. It is midline. There's no deviation. I'm going to check his thyroid. I need you to swallow. Good. Now I'm going to push it to one side. Have you swallow again. Push it to the other side. Have you swallow again. Good. Now I'm going to check your lymph nodes. Feeling with 3 fingers the occipital nodes, the post-auricular nodes, pre-auricular nodes, tonsillar nodes, the submental nodes under the chin, submandibular nodes along the jawline, the posterior cervical chain, the inferior cervical chain, deep cervical chain, supraclavicular, and supraclavicular. Good. Now I'm going to auscultate the carotid arteries using the bell of my stethoscope. With this one, I need you to take a big breath in and exhale and hold. Good. Listen for any bruise. Same thing on the other side. Inhale, exhale, and hold. Good. Assessing your thyroid using the bell again on either side. Good. Now I'm going to assess the upper extremities, the shoulders, arms, and hands. I'm inspecting first, looking at the musculature, assessing the color, the hair distribution, the skin for any lesions. I'm looking at the hands, the fingernails, the nail characteristics. The nail beds are nice and pink. There's no clubbing or cyanosis. His capillary refill is brisk and it's less than 3 seconds. Now I'm going to assess your brachial pulses, noting the intensity and regularity. Same thing with the radial pulses. Good. Now I need you to turn around and we're going to inspect your back. Excuse me. Now raise your shirt. With this exam, I'm inspecting for any skin lesions, masses, breaks in the skin. I'm looking at his respiratory rate is 18, even and non-labored. I'm looking that his chest is rising and falling symmetrically. All right, and I'm also going to stand at the side, look at thoracic configuration, noting that his AP diameter is 1 to 2. Now I'm going to palpate and percuss along the costovertebral angle. This should not elicit any pain. Good. Now I'm going to palpate expansion. I'm going to place my hands bilaterally about the 10th rib, and I'm going to have you inhale, exhale. Good. And I'm watching my hands to make sure that they are moving symmetrically from side to side. Next I'm going to palpate for tactile firmness. I'm going to ask you to say 99 when I place my hands on your back.
99, 99, 99, 99,
Good.
99, 99, 99,
Good.
99.
And this, with this test, I'm making sure that he has normal vibrations and that they're symmetrical side to side. So next I'm going to percuss his back using the ladder approach. So moving side to side, I should hear resonant sounds. I'm going to ask you to place your arms above your head, and I'm going to check the lateral sides. Same technique, ladder approach, side to side. Good. And you can bring your arms down. All right. Now I'm going to percuss for diaphragmatic excursion, which this maps the diaphragm's movement during full inspiration and expiration. So when I ask you, I'm going to have you take a deep breath in and hold it. And I'm going to percuss upward. Okay. Deep breath in and hold. Good. And I'm going to mark with a pen here where the sound changes from a resonant sound to a dullness sound. Same thing, I'm going to start up, percuss downwards, and I need you to exhale and hold. Good. I'm going to mark it again where the sound changes. Alright. And it changes from resonance to dullness. Normal should be about 3 to 5 centimeters, and his is about 4 centimeters here. Let's see. Yep, 4 centimeters. Alright. Next I'm going to auscultate your lung sounds. And with this, I'm going to use my diaphragm and my stethoscope. And this is a ladder approach as well. Inhale and exhale. Good. I'm hearing nice vesicular breath sounds. There's no crackles or wheezes. And arms above your head. Gonna auscultate the lateral sides here. Inhale and exhale. comparing side to side. Good. Alright, now you can turn around. I'm going to continue to oscillate the anterior chest. Push it up here. So inhale and exhale. Good. Okay. And while he's taking breaths here and I'm looking at him, I'm inspecting the anterior side of his chest. I'm watching his respiratory effort. I'm assessing for any nasal flaring, assessing for any retractions, any accessory muscle use. I'm looking at his respiratory rate and rhythm, that his chest rises and falls symmetrically, that his skin is warm and dry and there's no cyanosis or diaphoresis. I'm also inspecting his precordium. I'm looking for any heaves or lifts, which I see none. Now I'm going to palpate the precordium. I'm allowing the impulse to come to my hand. So the apex, the left sternal border, the base, and the apical pulse again. Again, assessing for any heaves, lifts, or thrills. Now I'm going to palpate over the anterior chest wall. This I'm noting for any tenderness, any masses. Alright, now to check for the infraclavicular nodes, the axillary nodes, and I'm going to have you repeat the words 99 again.
99, 99, 99, 99, 99.
Good. And this is checking for tactile fremitus, and it is symmetrical bilaterally. I'm going to percuss over the anterior chest now, making sure that I'm going between the intercostal spaces, and a systematic approach. Good. Now I'm going to listen to heart sounds with the valve of my stethoscope as well as the diaphragm. Good. Listening for the aortic, pulmotic, Erb's point, tricuspid, and mitral valve. Change over to the bell. Listen again. Aortic, pulmonic, Erb's point, tricuspid, and mitral valve. Okay, I'm going to have you lay on your left side and I'm going to listen again. So all the same areas again. Okay, next is the abdominal exam. I'm going to have you roll to your back for me. Alright, for this exam I'm going to start by inspecting the abdomen using tangible lighting. I'm noting the contour of the abdomen, which is flat. I'm looking for any pulsations, any movement, and also noting the color. Next I'm going to auscultate the abdomen using the diaphragm of my stethoscope. I'm going to start with bowel sounds. So left lower quadrant, listening for bowel sounds. She's got nice bowel sounds. Good. So using the bell, I'm going to change over and we're going to listen to the arteries. So the aorta, the left renal, the right renal, the right iliac, the left iliac, the left femoral, and the right femoral. Next I'm going to percuss over the entire abdomen using a systematic approach again, noting any tympany. I should be hearing that over the air-filled areas, and I should be hearing dullness over the organs. Next I'm going to percuss the liver borders. I'm going to start at the midclavicular line, and I'm going to percuss downwards, marking where the sound changes from tympany to dullness. And let me find my pen here. Alright, so starting upward, going downward. Hear the sound change, I'm going to mark. Starting down, percussing upward till the sound changes to dullness. Mark again. Normal is 6 to 12 centimeters. I'm going to measure him. And he is 10 centimeters. Alright. Next, I'm going to percuss the spleen. I'm going to have you turn slightly to your right side. So starting at the mid-axillary line, approximately at the level of the 6th rib, I'm going to percuss down, and you want to hear tympani. Alright. And have you take a big breath in and hold. Good. And exhale, I should continue to hear tympani sounds. Good. Now if you can roll to your back, I'm going to use light palpation and palpate the abdomen, noting any abdominal organs, masses, areas of tenderness. Good. Next, I'm going to use deep palpation. First, I'm going to start with palpating the liver along the right costal border. This can sometimes be uncomfortable, so I'm going to ask you to take a deep breath in and hold. So, palpating for the liver borders. Good. And exhale. Now I'm going to palpate the spleen. This is along the left costal border. I should not be able to feel the spleen. Alright. Now I'm going to feel for the spleen again. While I'm here, I'm going to palpate the left kidney. Good. Move over, palpate the right kidney. I'm going to palpate midline, and this is checking for any aortic pulsations. Good. Now I need you to raise your head slightly. I'm going to check the musculature of your abdomen. Good. And he's got good musculature. Alright, the next exam is the feet and legs. First, I'm going to start by inspecting the color. I'm looking for any lesions. I'm looking for hair distribution. I'm also noting muscle mass. I'm going to palpate his legs now, feeling for temperature, feeling for any edema. I'm looking at capillary refill, checking that in his toes, and it is brisk in less than 3 seconds. I'm going to palpate his pulses. First the popliteal behind the knee, the posterior tibial, the sides of the feet here, and then the dorsalis pedis on top. And they are all easily palpable and nice and strong. Next, I'm going to test for sensation of his legs. Now I'm going to ask you to tell me if this is sharp or if it's dull.
Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull.
Good. Alright, I'll pull this down here. And I'll have you stand up for me. Or sit up for me, sorry. Now we're going to check your reflexes. First, we're going to check the brachial reflex in your elbow. Have you bend your elbow? Good. Now your radial. Good. Popliteal. Alright. And good. Alright, so the Achilles tendon here, he had a nice plantar flex, so his foot moved upwards with that one. Next, I'm going to ask you to put your arms straight out for me, and I'm going to apply resistance. I want you to push up. Okay? We're checking for the musculature. Maybe straighten out your legs. Resist. Resist again. Other side. Resist. Good. Now I need you to stand up for me. I'm going to take a look at your spine, starting with your cervical spine. So cervical, I'm feeling thoracic moving down, lumbar, sacrum, and coccyx. I need you to bend over for me. With this test, I am watching to see if there's any curvature of the spine. noting if there's any kyphosis, which there is none. You can stand back up for me. And this completes my head to toe assessment, and I appreciate you viewing. Thank you.